Welcome to this video about the diagnosis of coronary heart disease using blood tests and imaging tests. Coronary heart disease is a condition that affects millions of people around the world, and early diagnosis is crucial for effective treatment and management. In this video, we will be discussing how blood tests and imaging tests can be used to diagnose coronary heart disease. We will cover a range of topics, including the different types of blood tests that are used to measure certain substances in the blood, such as cholesterol and triglycerides, that may indicate the presence of CHD. We will also be discussing various imaging tests that can be used to visualize the blood vessels in the heart and detect any blockages or narrowing. Additionally, we will be talking about non-invasive tests such as ECG, stress tests, and echocardiograms that can help diagnose CHD. We hope that this video will provide you with valuable information about the use of blood tests and imaging tests in the diagnosis of coronary heart disease. Remember, early diagnosis and treatment can make a significant difference in managing this condition, so it is important to stay informed and take care of your heart health. So, let's dive in and learn more about how these tests can help in the diagnosis of coronary heart disease. 1. Coronary heart disease is a condition where plaque buildup in the walls of the coronary arteries, which are the blood vessels that supply oxygen-rich blood to the heart muscle. This can lead to the narrowing or blockage of these arteries, which can cause chest pain, shortness of breath, and even a heart attack. Plaque buildup can occur over time due to various factors, such as high cholesterol levels, high blood pressure, smoking, and a sedentary lifestyle. It's essential to be aware of the risk factors and take steps to manage them to reduce your risk of developing coronary heart disease. 2. Blood tests are commonly used to measure various substances that may indicate the presence of coronary heart disease, including cholesterol, triglycerides, and C-reactive protein, CRP. Cholesterol is a type of fat found in the blood that can contribute to the formation of plaque in the arteries. High levels of cholesterol, particularly low-density lipoprotein, LDL, cholesterol, are associated with an increased risk of developing CHD. Triglycerides are another type of fat found in the blood that can contribute to the development of plaque in the arteries. High levels of triglycerides are also associated with an increased risk of CHD. CRP is a marker of inflammation in the body, and high levels of CRP may indicate an increased risk of CHD. Inflammation can contribute to the development of plaque in the arteries and increase the risk of heart disease. By measuring these substances in the blood, healthcare providers can assess a person's risk of developing CHD and take appropriate measures to manage their condition. This may involve lifestyle changes, such as diet and exercise, or medications to lower cholesterol or blood pressure. 3. High levels of cholesterol and triglycerides in the blood can contribute to the development of plaque in the walls of the coronary arteries, which can lead to the narrowing or blockage of these blood vessels. This, in turn, can cause coronary heart disease, CHD, and increase the risk of a heart attack. Cholesterol is a type of fat that is found in the blood and is necessary for the proper functioning of the body. However, high levels of LDL cholesterol, which is often referred to as bad cholesterol, can increase the risk of developing CHD. Triglycerides are another type of fat that are found in the blood and are also associated with an increased risk of CHD. High levels of triglycerides can contribute to the development of plaque in the arteries and increase the risk of heart disease. Managing cholesterol and triglyceride levels through lifestyle changes, such as exercise and diet, or medications can help reduce the risk of developing CHD and improve heart health. 4. C-reactive protein, CRP, is a protein that is produced by the liver in response to inflammation in the body. Inflammation can contribute to the development of plaque in the walls of the coronary arteries, which can lead to the narrowing or blockage of these blood vessels, and increase the risk of developing coronary heart disease, CHD. Research suggests that elevated levels of CRP in the blood may be associated with an increased risk of developing CHD. It is important to note that CRP is a marker of inflammation and not a direct cause of CHD. Still, measuring CRP levels in the blood can provide healthcare providers with valuable information about a person's risk of developing CHD. If a person has high levels of CRP, healthcare providers may recommend lifestyle changes, such as diet and exercise, or medications to reduce inflammation and lower their risk of developing CHD. It's essential to work with a healthcare provider to manage any risk factors for CHD and develop a plan to improve heart health. 5. Imaging tests are valuable tools in diagnosing coronary heart disease, CHD, and assessing the severity of the condition. A coronary angiogram is one type of imaging test that can be used to visualize the blood vessels in the heart and detect any blockages or narrowing. During a coronary angiogram, a thin, flexible tube called a catheter is inserted into an artery in the arm or groin and guided to the heart. A special dye is then injected through the catheter, which makes the blood vessels in the heart visible on X-ray images. The images can show any blockages or narrowing in the coronary arteries, which can help healthcare providers diagnose CHD and determine the best course of treatment. Other imaging tests, such as a computed tomography, CT, scan or magnetic resonance imaging, MRI, may also be used to diagnose CHD and assess the health of the heart. These tests can provide detailed images of the heart and blood vessels, which can help healthcare providers identify any abnormalities or damage to the heart muscle. Imaging tests can play a crucial role in the diagnosis and management of CHD, and it's essential to work with a healthcare provider to determine which tests are necessary for an accurate diagnosis and the best treatment plan. 6. Other imaging tests, such as computed tomography, CT, scans or magnetic resonance imaging, MRI, can be used to detect the presence of plaque in the blood vessels of the heart. CT scans use X-rays to produce detailed images of the heart and blood vessels, which can help healthcare providers identify any blockages or narrowing in the coronary arteries. CT scans can also be used to detect the presence of calcified plaque, which is a hardened form of plaque that can increase the risk of heart disease. MRI uses a powerful magnetic field and radio waves to produce detailed images of the heart and blood vessels. MRI can provide information about the blood flow in the heart and detect any abnormalities or damage to the heart muscle. MRI can also be used to detect the presence of plaque in the coronary arteries. Imaging tests, such as CT scans and MRI, can provide valuable information about the health of the heart and blood vessels and help healthcare providers diagnose and manage coronary heart disease, CHD. However, these tests are not always necessary and may carry some risks, such as exposure to radiation or the use of contrast dyes. It's essential to work with a healthcare provider to determine which tests are necessary for an accurate diagnosis and the best treatment plan. 7. An electrocardiogram, ECG or EKG, is a non-invasive test that measures the electrical activity of the heart and can help diagnose coronary heart disease, CHD. During an ECG, small electrode patches are attached to the skin of the chest, arms, and legs. These electrodes record the electrical signals generated by the heart as it beats. The resulting waveform pattern is then displayed on a monitor or printed on paper. An ECG can show any abnormalities in the heart's rhythm, such as an irregular heartbeat, which can indicate a problem with the heart's electrical system. An ECG can also detect any damage to the heart muscle, which may be caused by a heart attack or other heart conditions. ECGs are often used as a routine screening test for CHD and can be useful in diagnosing the condition, as well as monitoring its progress and evaluating the effectiveness of treatment. ECGs are non-invasive and painless, making them a safe and reliable diagnostic tool for healthcare providers to use. If an ECG shows any abnormalities, healthcare providers may recommend additional tests, such as a stress test, echocardiogram, or angiogram, to further evaluate the health of the heart and blood vessels. It's important to work with a healthcare provider to determine which tests are necessary for an accurate diagnosis and the best treatment plan. 8. Stress tests are a type of non-invasive test that can be used to measure how well the heart functions during physical activity and can help diagnose coronary heart disease, CHD. During a stress test, the patient is asked to exercise, usually by walking on a treadmill or riding a stationary bike, while their heart rate, blood pressure, and ECG are monitored. As the patient exercises, the heart must work harder to pump blood to the muscles, which can reveal any blockages or narrowing in the coronary arteries. In some cases, a stress test may be combined with a nuclear imaging test, such as a myocardial perfusion imaging, MPI, test. This test involves injecting a small amount of radioactive material into the bloodstream, which can help visualize blood flow to the heart and identify any areas of reduced blood flow. Stress tests can be useful in diagnosing CHD, as well as determining the severity of the condition and the best treatment plan. However, stress tests may not always be necessary and may carry some risks, such as an increased risk of heart attack or other complications in some patients. It's essential to work with a healthcare provider to determine which tests are necessary for an accurate diagnosis and the best treatment plan. 9. An echocardiogram is a non-invasive test that uses ultrasound waves to create images of the heart, which can help diagnose coronary heart disease, CHD. During an echocardiogram, a small probe called a transducer is placed on the chest or abdomen. The transducer sends out high-frequency sound waves that bounce off the heart and create detailed images of the heart structures and blood flow. Echocardiograms can be useful in diagnosing CHD, as they can detect any abnormalities in the heart structure or function, such as reduced blood flow, valve problems, or congenital heart defects. Echocardiograms can also be used to monitor the progression of CHD and evaluate the effectiveness of treatment. Echocardiograms are non-invasive, painless, and safe, making them a useful diagnostic tool for healthcare providers to use. In some cases, other imaging tests, such as a cardiac MRI or CT scan, may be recommended to further evaluate the heart structures and blood flow. If an echocardiogram shows any abnormalities, healthcare providers may recommend additional tests, such as a stress test, angiogram, or blood tests, to further evaluate the health of the heart and blood vessels. It's important to work with a healthcare provider to determine which tests are necessary for an accurate diagnosis and the best treatment plan. Thank you for watching this video on the use of blood tests and imaging tests in the diagnosis of coronary heart disease. We hope that you have found the information in this video helpful in understanding how these tests can be used to diagnose this condition. If you have any concerns about your heart health, please talk to your healthcare provider, who can help you determine if any of these tests are necessary for you. Remember that maintaining a healthy lifestyle, including regular exercise, a balanced diet, and avoiding smoking and excessive alcohol consumption, can help reduce your risk of developing coronary heart disease. Stay informed and take care of your heart health, and together we can work towards preventing and managing coronary heart disease. Thank you again for watching, and we'll see you in the next video.